I went through a life-changing challenge. I was not walking. I was paralyzed, didn't have any movement or feeling in my left leg. It was very traumatic. I went from being athlete of the year to all of a sudden I woke up and couldn't move. I was referred to Dr. Bayless by Dr. O'Neill, and it was his first year in practice in orthopedic medicine. He decided to take me on, and because he did, because of his expertise and dedication, I was able to walk again, and he fixed me. I'm so grateful for Dr. Bayless. Without him, I would not be mobile right now. Not only did he support me in that time, I was able to regain my mobility. Over the years, I've always come back to him, and he helped me with a torn ligament in my shoulder. He's always been very supportive. I'm super grateful for him.
It goes back to when I was a child. When I was 5 years old, I will never forget running up, jumping in my dad's lap. He gave me a big hug and said, "One day you're going to be my doctor." And at 5 years old, I thought, he thinks I'm smart enough to be a doctor? I couldn't believe he said that. But it never left my mind. For the rest of my life, I was determined that I was going to be a doctor. I'm Robert Bayless. I'm an orthopedic surgeon. Born and raised in Springfield, Missouri. I've practiced here in the Metroplex for over 30 years now. As I've grown older, I've become more and more interested in longevity and health and wellness.
Being a medic in the Army taught me a lot about discipline, about self-discipline, doing what needed to be done regardless of the circumstance or my own personal feelings. Being able to follow someone from an injury and watch them improve and go from being in pain, seeing the outcome where they return to the normal function is very rewarding.
I'm a doctor first and a surgeon second. I always look at the whole person and again, listen to them and figure out what they are looking for. We think we give a more personalized service. We treat every individual as an individual. It's not like a factory here. We take care to get to know the patient. I listen to them. I don't just run in and say, "Oh, you've got this, let's do that." I listen to their problems. I listen to what they're looking for, to what their desires are, why they came to see me. It wasn't just so I could put a cast on their arm. It was so they could recover and get back to playing piano or whatever their lifestyle demands were.
It's been a very exciting period for medicine. Over the last 10 years, we've delved more into what the body does itself to repair itself. And that's what ortho biologics is, and that's where we're centering our focus now. What that is we take the body's own repair mechanisms and we concentrate them and put them back into the area that needs the most repair.
It's gratifying on a daily basis to see people come back in where their shoulder pain is gone or their arthritic knee is no longer painful and they're functioning better. I do a lot of surgery and I do a lot of non-surgical treatments, and both patients, once they get better, get more functional, you get back to life doing what they enjoy, be that golf, playing with their grandkids, or just out walking and hiking. They are very grateful. Makes me very happy to see those results.